Okay, so I'm so excited today to be interviewing Dr. Michael G. It's Gurevich, right? Did I say it
Gurevich,
right?
right,
Yeah, and so today on What Happens in Vegas podcast, we're going to go into learning from one of the most profound treaters using something called neural therapy, which is something that helped me profoundly heal my health from Lyme disease. And you are a board certified psychiatrist, and you
right.
found all of these more holistic ways to help your patients. So thanks so much for being here. And yeah, just tell us how you got into this space.
Yeah. So I started my psychiatric career close to 40 years ago. And at that time, of course, I was very conventional psychiatrist. I was put in charge of taking care of the substance abusing patients. And I knew very little about it. And so many of them were failing. I went, I studied, I passed the board in the American Board of Addiction Medicine, and still with all my knowledge, they've been failing. So I learned about this 5-point auricular acupuncture, ear acupuncture, and that was simple technique, but it was working. And that opened a door to learning more about the whole body acupuncture. And that was completely new for psychiatry at that time, and for me in particular. So learning about it opened a door that there is a completely different way of how to assess and how to treat people.
Mhm.
And that kind of put me on a lifelong search of what is working in psychiatry and how to help people with emotional and physical issues. And one of my big mentors was Dietrich Kleinhardt,
Mhm.
but I have learned from many different practitioners.
Mhm.
But from him in particular, I learned a number of tools. And one of them, you mentioned neural therapy,
Mhm.
which probably at this stage, I'm probably the only psychiatrist in North America who is using these methods. So I would be interested to know what helped you, and
Mhm.
I will tell you a little bit about what I do with neural therapy.
Yeah, so I was telling you before we started recording, I got severe Lyme that turned back on in 2021. So originally in 2010, one went undiagnosed, but then being younger, that's when I got into functional medicine. I treated parasites and stuff, and my body got it under control. I had 10 years of remission, but in 2021, it all came crashing down again. And one of the symptoms I have is like severe panic, but also like kind of my body also gives obvious symptoms. So I had like lymphedema, like swelling. So the neural therapist who I saw who introduced us, um he started off by doing like just the stuff to see if how I handled because it's an injection of procaine. And procaine, just so people know, is, no, actually, I'll let you tell about neural therapy and what you use. But he just saw how my body handled it. So he put a little bit in my vein and a little bit in my thyroid. And I felt calm that night for like the first time in,
Mm.
however many months I was suffering with this reemergence of Lyme disease. And then we went further to inject different um, nerve bundles, even the vagus nerve, my, interference fields like scars and stuff like that. So I'll let you talk more about that. But we started going all over the body. But one thing that was profound for me was when I had severe lymphedema on my left side and I was having severe heart palpitations, he needled that. What's the pearls called that they do? They call it the pearls or the
Yeah,
necklace.
yeah, okay, yeah.
And I started, after those injections, I started getting severe palps. But as each palp happened, the swelling went down. So it was just
Mhm.
all of those toxins clearing through my
Right,
heart. And then
right.
I felt such relief after that. And I just, that's how I got more into bioregulatory, more into learning from
Mhm.
Deirdre Klinghardt as well. And now here we are talking, and you're using a very specialized technique with neural therapy. So if you could just share with us what neural therapy is exactly and how you're using it, that would be amazing.
Yeah, yeah. First of all, if I can just make a little comment of what you mentioned, it all started in 2021,
Mhm.
and that is a Lyme, I'm sorry, this is the COVID epidemic.
Yeah.
And what I personally seen with COVID and experience actually myself, that the COVID kind of wakes up all kind of infections that have been forgotten for a long time.
Mm.
So I forgotten about my injured knee and hip, and suddenly, after I had a severe COVID, it all reemerged. Couldn't do my yoga for several months.
Mhm.
So I needed honeybee venom injections. I don't know if you do that one.
No,
So
I don't, but I know some of my patients where it's helped immensely for them. And I'm allergic to bee stings, so
uh,
unfortunately,
uh, uh,
maybe not for
uh,
me. Or maybe
that's
maybe I'm not anymore because I've detoxed so much, but I don't know if
yeah.
I'm ready to try.
Quite a few people confused honeybee venom with other stuff. So check if it's really honeybees.
Oh, yeah, I should
People,
actually. I've never had like the actual test. Maybe it was like a wasp sting or something that I
yeah,
got.
wasps are more likely to create severe allergy than
Yeah,
the
yeah.
bees. Yeah, yeah, yeah.
Yeah, but I
But
agree with the COVID thing 100%. I was treating someone that very day that had got COVID. I never got symptoms of it, but unless those were my symptoms, it just emerging that. And then, yeah, and then in February, that was in November, I was getting way better by February. And then I got my first symptomatic COVID infection, and all of my symptoms came back that I had just gotten over. And it was like this whole
I would,
resurgence.
my bet would be that this was a COVID which woke up everything. So
I believe you. I'm there with you.
so yeah, yeah, but I don't know exactly, and I cannot diagnose you online.
No, but I agree with you. I think it definitely was one of the factors for sure.
Yeah, yeah, yeah. So as I mentioned, I'm a psychiatrist, but kind of sort of in some way, I'm not a rebellious guy, but just kind of seeing how psychiatry, sort of imperfect in many ways, turn got me looking for all other ways. So one of them is neural therapy. So what is neural therapy? Neural therapy is an injection of local anesthetics, and it was developed independently in Germany in 1920s and former Soviet Union at the same time. And they sort of worked independently, but in many ways they found very similar results, that injecting local anesthetics, and at that time the most popular was Procaine or Novocaine. It is the first short-acting local anesthetic, which was developed at the end of the 19th century and basically expanded quite a lot. And doctors in Germany and Russia have tried it, and they develop a technique. So in Germany, it called neural therapy. In Russia, it called Novocainovые blockade. Then it became very popular after World War II in Turkey and Spanish-speaking countries. And Kleinhardt brought it to United States in the 1980s or so. And so I was one of his students, and I organized some workshops in the mid 2020s, and that's where I met Nick Bolis, who did your injections.
Hmm.
So he came to several of uh, seminars with me, and Nick was always enthusiastic. He gave
Yeah.
himself for injections. He was volunteering for everything. So he's a
Yeah.
very, very enthusiastic guy. So you have an excellent doctor taking care of you.
Yeah, it's been amazing, even bringing my patients to him for some treatments as well.
Yeah, yeah. What was interesting, and luckily I didn't know it, that for many years neural therapy in Germany was contraindicated to treat psychiatric conditions.
Oh.
And I didn't know about it when I learned it.
Mhm.
And Dietrich Klinghardt, who himself kind of a rebellious and very, very advanced practitioner, never mentioned it. So I learned it when I was already doing it for 10 years.
Oh,
That's
wow.
when that's when I got my first book on neural therapy, and I saw that, oh, it's a contraindicated. I didn't know about it, and my patients are doing well.
Yeah, so clearly not contraindicated.
Really not. And actually, what happened, I did a presentation in 2017. We organized first symposium on neural therapy in North America, and there were several masters from Europe, from South America, and and some of them were doing it, so it became an open secret. And now there are a number of practitioners who are doing it, not psychiatrists yet. So psychiatrists are, as a psychiatrist are afraid of injections.
Mhm.
So, and the way neurotherapy is done for those patients, as you mentioned, one of the interesting thing that when we have some sort of a physical, and later I learned emotional trauma, it creates so-called interference field. What it is, it was found in 1940s that when if there is some sort of a physical injury, let's say you have a tooth which is inflamed, and this tooth can cause the pain on your shoulder, which kind of, how could it be? But the probably the etiology of that the nerve stimulus from the tooth go to the brain, then goes through multiple different regions and get back to a wrong region, and the patient may develop a pain or issue in a completely different part of the body. And so unless you address this interference field, unless you kind of, and I will talk about it, so the pain in the shoulder may not go away. What I also learned is that this emotional stress, emotional trauma may also create an interference field. And it can be, and people quite often would tell you that when I stress, I feel pain in a particular place of the body. Heart attacks is a well-known issue. You know, people, it's a kind of, on Monday morning, the 30% of all myocardial infarctions happens on Monday morning.
Mhm.
People are kind of afraid what's going to happen when they come back to work.
Mhm.
So it's an interesting, so stress is can be a big cause of that. And Dr. Klinghardt taught me, as well as many other people, how to use muscle testing technique, and he developed his particular kind of style called autonomic response testing, and I modified it in many ways to find the interference field in a different way that he does, but very similar. Don't need to talk about the specific, but with this particular testing, you can identify where exactly the psychological trauma resides.
Mhm.
And basically, by just touching the body or even going close to the points where people hold this energy, you can feel and then find out with muscle testing where it is. And then another thing that Dr. Klinghardt introduced is the is the fact that Chinese acupuncturists thousands of years ago developed an understanding that different emotions resides in different energetic organs. So, for example, the liver is a place where you have your frustration, anger, and disappointments, and by touching this place, you can see that there is a resonance with this emotion. So, and through the muscle testing, you can identify where a particular issue is, or if it's difficult to find, or if you've done some treatments and it's difficult to find, just by asking people to focus on their negative emotions, suddenly recreate so-called interference field, and you can once again locate it. And any questions so far, and then I will continue.
So just to summarize, you search for interference fields, which for you, you're looking for blocked emotion and trauma because you're working a lot with mental health in general, right? Whereas some people use interference fields as like a scar on the body, correct? Or do you do the scars as well?
So it is both. I'm looking for the emotional as well as for physical.
Okay.
For example, let's say one of my patients had postpartum depression. She was a lady in her mid-30s. She was a high-powered attorney, and she had only one child who was 3 years old at the time. But she wanted to have a perfect delivery, and it didn't happen. It was kind of, when she went for delivery, it was multiple ruptures, and she had a big episiotomy scar. But for the about 3 years prior to coming to me, she was kind of depressed, angry, upset, and was on several medications. When I was examining her, I asked her to touch this episiotomy scar, and it was a big interference field. So when she allowed me to inject it, and I had her husband, of course, in the office holding her hand, when I began to inject her episiotomy scar, suddenly all kind of memories, emotions, feelings began to kind of pour out of her. And a lot of frustration, anger, tears. And but then she felt much better. So she came again. So her first anger was at her mom, because she felt her mom was not supporting her while she was going through the process of giving birth. Then when she came in a couple of weeks and we did injection again, this time, once again, a lot of emotions, but this time her husband, all that negative stuff about her husband came out. So, but then there is a way I can measure how significant the issue is. And significance was going down and down and down. By the third time, basically, we were done. She finished with some other frustrating emotions, and emotionally she was okay. We were able to, over the next couple of months, I never do it rapidly, I was able to get her off her medications.
Wow, that's so
In
powerful.
addition, she also had a Lyme issue, so we treated that at the same time with the IV therapy.
What kind of IV?
So I do so-called major autochemolytic therapy. It's combining. I don't know if you know it. It's basically where you take some blood from the patient vein. You then put this blood in a normal saline solution. You inject ozone there, you mix it well,
Yeah.
then it goes back into patient vein, but while going back, it passes through ultraviolet light machine, and then it goes into patient vein.
So like
It,
Ebu, is it Ebu?
I'm sorry,
Is it like the EBOO?
ultraviolet blood, right?
Oh, okay.
EBV,
Um,
ultra.
I did the ozone therapy, but not, they didn't use a UV light when it was going back in for me.
So it can be without it. It's just I
That would be,
happen, and it's a
yeah,
good,
that's good.
it's a good, it's kind of, it's additional tool.
Yeah, I like that.
Yeah, and then there is a minor autochemolytic therapy. I don't know if you know about that one.
Mhm,
It's basically where you put in a syringe a little bit of ozone,
mhm,
and then you take a little bit of blood from the vein.
mhm,
Let's say a syringe, you take some ozone and you take some blood, you mix it well,
mhm.
and then you inject it in the points, so-called, where you feel the infection is, or
Oh,
where there is the interference field is.
oh, I want that. I can think of some spots that I'd want that injected. Maybe I'll have to come visit you.
I'm sure Nick can do it. That's a very
Okay, yeah.
easy one, and
Yeah.
but you're always welcome.
Yeah, I don't know if he keeps his ozone machine at work anymore, but yeah, he could. I know that he's done some auto chemotherapy, but without ozone, um,
Mhm.
for like different when people have acute illnesses, like
Yeah, it can be done with or without ozone.
oh, okay.
If you like, I mean, it used to be minor and major autochemolytic therapy used to be a big deal
Mhm.
and the big treatment options before antibiotic era.
Yeah, exactly.
And there is a lot of articles even after antibiotics came around.
Mhm.
If you like, I can email to you a couple of books even,
I would love
uh,
that.
which talks about, how it is helpful in multiple conditions.
Yeah, I would love that. I know how powerful it can be, and there's different ways of using ozone too that people do direct ozone IVs. So like when they put the ozone right into the blood.
Right, right. That is a bit more problematic.
Yeah, for the
there
lungs.
are some uh, that is that's more dangerous
Yeah.
because number one, it can create some issues with your vein. Veins become sclerotic, or
Yeah.
and then and then it can cause, if it's not careful, it can cause the embolus.
Yeah, the lung, people get a lot of lung pain during it too, like if they go too
Right.
fast. Yeah, I've never done that one. That one seemed a little scary for me, but I just know that some people still practice it, and I mean they get results, but yeah, you're right, more of a risk. Why would you do it with more of a
Yeah,
risk?
this is a big risk. Yeah,
Yeah.
even Academy of Ozone Therapy, and I used to be a member of them, is saying that this is a contraindicated.
Yeah.
So this is ozone. Ozone is a wonderful tool in multiple conditions, but giving it straight intravenously is dangerous.
Yeah. I I I like the more safe route myself, conservative. So
Right, right, right.
and how safe is neural therapy? Because that has a lot of safety in it as well, neural therapy.
So neurotherapy is basically over the world done with primarily with two agents.
Mhm,
One, as I mentioned, procaine, and another one is lidocaine.
mhm,
So procaine is a short-acting local anesthetic,
mhm,
which gets uh, which gets digested, so-called, right on the place where it is injected. So you don't need liver or kidney to let go of it.
mhm.
Lidocaine, on the other hand, does need a healthy liver, and in some ways it's considered to be a little bit more toxic, but it's still quite safe, and many people are using it.
Mhm.
So in some countries, in some South American countries, they're using even the older preparation where they mix it with a little bit of cocaine. So but most of us are using procaine made in compounding pharmacies, which are very safe,
Mhm.
and side effects are quite rare. Of course, anything can have side effects.
Of course.
So, but if it's done, if when you do injections, you penetrate some big organ like lungs, so of course you can develop a
No.
negative impact.
Yeah.
So, but we all are aware of how we inject, where we inject. Uh, the the issue is that neural therapy have been developed for almost have been in development, have been used for almost 100 years.
Yeah.
So they develop a safe way how to do the superficial injections
Mhm.
as well as ganglia injections. And ganglia injections or nerve centers injections on the body is require more skills
Mhm.
and and that's where I personally needed more training to learn it, and
Mhm.
that's why Nick kind of was coming to New York to learn it.
Yeah. Yeah, I had some of the ganglia injected, the sphenopalatine, the vagus, the
And stellate, I guess.
phthalate, yeah. Um,
Right,
so yeah, and you can have like just like some temporary like numbness, or you can get like different symptoms that come along with each ganglia, but it's very short lasting. And
right, right,
usually when you have those reactions, even people get better results after, right? But like you were
right.
talking about side effects, like you can have side effects to anything these days. Don't you find people are much more toxic, especially, we talked about COVID. So since COVID, it's re-emerging all of these inflammation and this cytokine storm, like, and mast cell activation. And honestly, like you give someone a binder and they can flare. So, it's other than that, that's the own body hyper reacting. And
Right.
I've experienced it with multiple things. Even ozone was hard for me, like the auto
Right.
chemotherapy, because like I was just so toxic that
Yes.
actually when they took the blood out of my body, I just wanted it to stay out. Like I felt
Yeah.
so good with that much
Right.
blood out of my body. And then as it
Right.
came back in, I started getting heart palps and stuff, because then your body has to filter all
Right.
of that afterwards, right? So
Right.
then ultimately it helped me, but I had to get through a few bad days where I had
Right.
to detox everything, right?
Absolutely. Absolutely. That happens. That's why, when I start giving a major autochemolytic therapy, which you describe, I start usually with a small dose of blood,
Mhm.
small dose of ozone
Mhm.
to see how people tolerate it. And
Yeah.
then gradually I increase it.
Yeah, that's amazing, because I know some people they go straight to like 10 pass or straight to this, and I know it can like,
That I burn myself a few
yeah,
times, so I have seen it. So I'm you know and plus I'm seeing the patients who are more emotionally
yeah.
uh, sensitive, so I need to be extremely careful with them.
Yeah. And can we talk about, because, okay, mental health, you're working through the trauma and everything, but we were talking before how, I felt completely fine. Mentally, I'm stable. And then I get this Lyme infection and I have the most severe panic I've ever felt in my entire life.
Right,
Right. And so, how many people do you think over the years have just been? Because if I didn't know what I knew, when I went to the emergency, when my heart was going crazy and I was feeling like that, I was told, oh, it's anxiety, oh, it's, psychosomatic or whatever. Like, And, you know, I could have got brushed off and then just treated with medication to shut down anxiety. Meanwhile, my underlying thing was like this inflammatory response. So how many people are suffering with mental disease that really have like a stealth infection, even though mine wasn't stealth, it went acute, but like, you know, parasites, this and that. Like, can you talk to that for mental health from
Yeah,
your lens as well?
yeah, you're absolutely right. See, psychiatry, the way it is now, it is, and we all psychiatrists understand and realize it is a very kind of, in some way, primitive discipline,
Mhm.
because basically, all the diagnosis is done on them using so-called DSM-5 now, Diagnostic Statistical Manual of Psychiatric Conditions. And basically, psychiatric conditions are described as a, um, as several symptoms, and the patient has to meet a particular menu of number of the symptoms to be diagnosed with the particular condition. So it's very much become subjective to the patient when he comes to the doctor, what they will tell the doctor they experiencing. But then there is another very subjective part is the doctor himself, from his own personal experience and how much time they have, they may ask you about your infections, or they may just focus on the narrow list of the symptoms that you are describing to him. And if your list of symptoms, anxiety, insomnia, panic attacks fits in, they say, okay, you have a panic attacks. So psychiatrists really interested in the etiology, what kind of caused the condition. So so for me it was an important tool, and actually, you know, the way I work is I'm from Clean Heart School, so there there is a way to record the frequencies of different infections.
Mhm.
And then basically, when patient is on the table, and I use massage massage table when I am examining patients, you can see if the patient's frequency resonate with a particular infection.
Mhm.
And then actually using the disk where those infections are recorded, you can actually pinpoint where exactly on the patient body or the brain those infections are. And then when you do your injections or whatever therapy, you can see how it will work for particular issue. For
Yeah.
example, quite often people with obsessive compulsive thoughts have some parasite infections, usually located in their large intestine. And so you can find exactly place, you can pinpoint how big this place is. And then by giving antiparasitic therapy, you can see how this area becomes smaller and smaller, and the patient's symptoms becomes smaller and smaller. So there is a correlation there.
Wow, your patients are
Um,
very lucky to have found you as their
yeah.
psychiatrist.
So basically, if psychiatrists kind of fall, you know, because they didn't have time or because they didn't have knowledge or information, just kind of misdiagnose you, unfortunately, you're not going to get proper therapy, and then your infection creates all kind of symptoms, and that's why I feel I'm lucky. You know, I can with the tools that I learn, I can suspect. And then I'm medical doctor, so I need to be careful, you know. I cannot tell them you have Lyme, you know, I cannot tell that. I can tell that I suspect that you might have Lyme. I
Mhm.
suspect you might have such and such infection. Let's do
If
the
if you can't tell them they have Lyme as a medical doctor, then who can tell them they
No,
have?
no, I can, but what I need to do, because the diagnostic tool I'm using
Oh, does it fit in
is,
your conventional? Yes, yes, yes.
that is not recognized by the medicine.
Okay, yes. Uh-huh. I
So
understand.
what I can do, I suspect you have Lyme,
Yes.
and then let's go through the formal testing to see if I am right.
Yes. But the
And I
testing
also,
can even miss sometimes, right? So sometimes,
right, and the conventional testing, unfortunately, particularly I'm in New York State,
mhm,
has its own enormous limitations, because we are not allowed to use most of the laboratories that all other states
yeah.
can use.
Do you know that you guys just got approved to use Vibrant Labs Lyme testing, the tick-borne 2.0?
Yeah, okay, I need to find out.
Yeah,
Okay.
because I think it's a pretty big deal for that company. It's called Vibrant Labs, and it's the first like, non-conventional test that's actually really, really great. Uh, and yeah, they're allowed in New York City now. So I know that that company was like very proud of that. They have like very um, diagnostic technology that's quite reliable. So yeah, look into it because I can connect
Okay.
you with the guy that gets us like our representative because he was the one telling me, and I was pretty excited
Mhm.
for New York for that because I know it's like an endemic area too.
Yeah, 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 absolutely, absolutely. We have New York, we have Connecticut, Vermont. We are surrounded
Mhm.
in Pennsylvania, so it's unfortunately we are quite endemic. Yes, I agree.
Mhm. But even, I mean, I think it's everywhere now, or people, it's reemerge, it's coming out more because you said even COVID, and we can talk about that. Even, there's lots of studies showing that long COVID increases people's Epstein-Barr from reemerging. So
Right.
obviously it can do the same for Lyme and Babesia and Toxoplasma and all these other kind of stealth infections. But I was listening to a talk from Klinghardt, and they're saying how even the virus itself can persist, right? Like, so people
Right.
think it's long COVID, but they still have COVID stuck in some organ or whatnot.
Yeah. Yeah, yeah, absolutely, absolutely. And that's where my feeling is the neural therapy with autonomic response testing, it can point the places where
Hmm.
it got stuck.
Hmm.
And then by doing injections around that area, it helps to move it on.
Hmm. Yeah, and that's the thing. So that's the other thing that was like aha moments through my own struggles, right? Was once the body was flowing and the lymph was moving, and maybe the Lyme's not completely gone, but I feel way less symptomatic when my lymph can move and all, and that's part of what um what I saw with myself is like procaine moves the stuff out of the area, right? And have you ever heard of biomagnetic therapy, when they use the magnets?
Yeah, 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 yeah,
I mean, if I think about, procaine going in and like moving it out and like magnet therapy, that's there's what they say, it like pulls the polarity apart. And I had
yeah.
some treatment of that too, and I found it helpful. Like it's that same thing of that stuck when things are stuck, right? If we can just
Right.
get things moving and flowing, we can get back to health and vibrancy, right?
Yeah, we are energetic being, we're 99% empty space. There is a so we kind of we don't see this emptiness. So, but it's all energy moving in us.
Yeah.
If you look at biology, every cell is an organ on its is a city on its own with
Mm.
all communications, with all the intelligence there. And then they're connected as organs, and then they're connected as a body. It's an incredible who we are. The more the more I'm learning it, the more it's astonishing. So, and we didn't know it
No.
when I went to medical school. We just didn't know it.
No,
Uh,
you're just like compartmentalized to different, sections of the body. Like, psychiatrist is like brain or mental emotional. Then there's the cardiologist. Then there's the, urologist, and like everything is just so intertwined, like they can't be separated, right? Like everything talks to
Yeah,
each other, like in our whole body.
yeah. We're communicating in some amazing ways. And that's why I think the psychiatry, and that's why the method, this trauma resolution therapy, that I find to be so helpful.
Mhm.
So
And we all have trauma, and like, we can have trauma from generations back too that we don't even realize that we're holding on to.
So it's actually what you're mentioning. So the last issue of American Journal of Psychiatry
Mhm.
kind of talks about it's very appropriate for our talks about PTSD,
Uh-huh.
and there is a whole big article about this epigenetic stuff, which basically talks about that trauma is in some way inherited in us,
Yeah.
and I'm experiencing it, or have experienced, or still experiencing it myself.
Mhm.
My father was born in Poland before World War II, and then when Germans were coming, he didn't know about the Holocaust, but he knew that he was a from young kind of communist organization, or semi-communist organization. So just 2 hours before Germans were coming, he was able to run away, but
Wow.
all his family was killed,
Oh,
including his first wife and his son.
oh,
And in some way, and that's what brought me to Clean Heart. When he was doing one of his workshops, I had a memory, one talk between my parents, uh, telling about this incident that my father had his family before, which I didn't know. And that sort of reemerged my understanding that I am carrying some sort of uh, trauma from all this period.
yeah.
And there are studies, and I'm seeing, let's say, a lot of ultra-Orthodox Jews whose grandparents escaped from the Holocaust,
Mhm.
but their grandchildren are still affected by that,
Yeah,
kind of physical ways, physical and emotional ways.
yeah, and I feel like we've had a new set of trauma with all of the COVID rules and all of this stuff that really traumatized people in a different way, right? Obviously, it's not
Right.
as obvious. My grandfather was Polish as well, and his ship was blown up in the Navy, and he survived.
Mm-hmm.
And so when I was working with Klinghardt and they were doing um the family resolution.
Systemic family constellation work, Hellinger work, right?
Yeah, it came up for my grandfather, that I was holding on to this trauma, and there was like entities attached, and they did like some clearing stuff on that. So yeah, it's all really interesting and amazing, like
Right.
cells and how they hold on to things, and epigenetics and fascia. And I just think, I'm so interested in it, just like as you are, and I hope people listening, like it's just like it's just magical. Like it makes you think there's so much more bigger than ourselves, and every little cell holds so much information. So,
Mm.
we need to find different ways of approaching stuff, and that's what you've been doing. And I, like I said, I think your patients are very lucky to find you. But so I found all this through my own health struggles, like, and you
Yeah.
found this just by observing that your patients weren't really responding to the types of treatment that you were taught, or right? And you thought there's gonna be like, I find that amazing when someone can, you know, make that change, because I feel like when you're in medical school and everything's so like dogmatic almost, or just like so
Right.
instilled in you, it's like it's very hard to unlearn and see like a different way of looking at the body. So I find that really, really impressive and amazing that
Yeah.
you did that through your patients. But was there anything in your own health that you kind of saw or worked through, like through all of this, or?
Yeah. Yeah. So of course you of course quite a few, so I as a child I developed torticollis, meaning my
Mhm.
neck was a little bit bent, and my mother, who was a surgeon, picked it up, and at that time, it was 1950s in Soviet Union, so I had the surgical intervention. They cut the front leg of the sternocleidomastoidus
Oh, wow.
muscle, kind of, it's a small surgery, but I was just 5.5 years old.
Mhm.
So, and within few months, apparently, after that, I developed a stuttering issue.
Oh.
So, and it kind of affected my life in many ways. So when I was learning injections, so the first injections, of course, I did on my scar.
Mhm.
I did a lot of them. So
Did it
and
help? Helped you?
I think so, but there is still I keep my tension in my shoulders, but that's another thing. So it's not connected to that. That's why I like my bee venom.
Oh,
So
yeah. It helps you
so
for pain and everything, right?
I'm
Tightness.
sorry.
And like bee venom's very good. It's like an anti-inflammatory, very potent.
Yeah. It's a powerful tool, and there is a way, the way I'm using bee venom, that you can. There is a people who know how to extract it from honeybees without killing them, and
Really? This is
yeah,
what
yeah, of course.
because
Of course.
Kleinhart said he used to have a person doing that, but then he wasn't doing it anymore. And I didn't know if there was anybody still.
I can give you the fellow in Romania who is doing it, and
Oh,
I'm ordering it from him. It
uh,
used to be Michael Simix in Canada.
yeah. Yeah,
Who
in
was
the West
doing it,
Coast. Yeah.
but now he apparently sold his equipment to this fellow. I need to find, I can give you his
Oh,
name.
perfect.
Oh, okay. Hold on. So let me, you want to do it now, or I can, or if somebody else is interested, I
You can
can,
well, you can email me after and we can put it
yeah,
into the show
yeah.
notes. Okay, so
Sure.
I'll be sure to write to you for that because yeah, I mean, because I love honeybees. Like I'm obsessed with them. I can use all of their products. Like I'm apparently allergic to bee stings, but again, that can be challenged. That was from so long ago. And I was allergic to wheat and now I can eat, like I was diagnosed with celiac, but now I can eat a little bit of wheat since clearing
Mhm.
out stuff, right? As long as it's like organic and sprouted and all of that. But um all of the other bee products have been life-saving for me. Like, I mean, I used propolis as part of my treatment and I use it on
Right,
almost everyone for so many different things, including like all the protection from different electromagnetic frequencies. But I mean, bees are just amazing parts of our ecosystem as well,
right,
right? And even they show the people with the longest lifespan are beekeepers as a
right.
profession. That's crazy.
Right. They consider to be very healthy. Unfortunately, some of them become alcoholics, which cuts on their life
Really?
life. Yes, yeah, that's another statistic. But
Oh, I didn't know
so,
that.
but those who are not, they live quite long,
Yeah,
and they are not afraid of bees biting them.
yeah,
And it is very used to be very uncommon that people would have severe allergic reactions. But now, as you mentioned, with all the toxicity around us, that is probably more common. However, when we inject honeybee venom, we mix it with procaine.
oh, okay.
And so it is, of course, reduces the pain,
Mhm.
and then the allergic reactions almost like unheard of.
Wow.
It can be a reaction which can last, several days,
Hmm.
but anaphylactic shock is unheard of.
Yeah, yeah. I mean, again, like I said, we were talking, I don't know if it was while we were recording or before, but I mean, it could have been a wasp at that point. I was younger when I got stung. I don't think it was a
It
honeybee.
probably was a wasp. The honeybees rarely bite you unless you're aggressive with them.
Yeah, which I wasn't.
So it's if you know about NAT,
Yeah,
so you can try that one, or you can try somebody just to test you for
yeah,
honeybee venom and to see if you are allergic or not. It's not a complicated test.
yeah.
Actually, when I have a first time, I do it to the patient. So I would this honeybee venom comes in a little vials, and you can know in 0.1 cc of this solution, usually equivalent of honeybee venom, uh, equivalent to one honeybee venom sting, and
Okay.
you dilute it with 2.9 cc of procaine.
Mhm.
And then the first injection, usually somewhere on the arm, you inject just 0.1 cc, meaning it's a very small dose of one honeybee venom sting. And
Okay.
then you observe the reaction, you measure it, and in that way you know if it's an allergy or not.
Yeah.
And so
I
it
think
can be done in a very, very safe way.
Yeah, I think I'm going to do that. You were talking about teeth before, and I actually have to get my root canals coming out in the next few weeks. And just like the importance of teeth as interference fields as well,
Yeah,
right? Like because they're all connected
tremendous.
to
Right,
organs.
right, right, right. There are maps, there's several different maps, but they look close to each other, and they show which tooth is connected to what.
Mhm.
And the teeth are connected to organs as well as connected to some emotions.
Yeah, so it's my first molar, and
Yes.
one of the things it's connected to is the ileocecal valve. And since everything flared with my Lyme, my ileocecal valve like bulged out. I had such severe problems with it. So when I made the association with the tooth, I was like mind blown because it's like one of those like I said, my body gives very obvious kind of signs. It's like, and it's almost like always very textbook, but um yeah, it's been quite the learning experience. So it'll be interesting to see when I get this out if I can get over those lingering symptoms
Yeah.
that I've been having, right? So,
Yeah, yeah. When you do it, just see that. I mean, if it's a molar tooth, probably you're not gonna put any implants. Probably not needed. Is it tooth number 32? You're pointing on the lower
oh,
side.
it's 44.6. They said I would need an implant, but I was gonna do porcelain but
Yeah, yeah, yeah. Zirconium implant, if you're gonna
zirconia.
do it, but you first want to see that it's fully healed,
Yeah,
uh, because otherwise it's gonna be rejected.
yeah, I know.
I,
I'm not looking forward to it because even my tongue tie, I got my tongue tie cut through all of this. And it was a huge change for my vagal tone once I healed. But it's usually with a tongue tie cut, people are better in a few days. Like it took me like 3 months. I got severe, like the lymphedema under my tongue was gigantic, like because she had to go deeper into the tongue fascia as well, and the scar tissue that was laid down and all of this. But now afterwards, like morning anxiety is gone. I feel more calm than I have maybe my entire life. But that whole like occlusion, like it doesn't let you drain when your tongue is stuck too. So I know like that goes along with neural therapy because it's always helping you drain. Um, and neural therapy helped me get over that because I was able to get injections to like clear under the tongue and all of that.
right. So one of the very helpful injection for you, maybe, and of course it needs to be evaluated, there is a superior cervical ganglia right here,
Mm-hmm.
and because it is connected to teeth. And the biggest injection in anything above the diaphragm, including everything on your head, is stellate ganglia.
Mm-hmm.
Stellate ganglia. That is one injection that I love among all the all the other injections because it help people to calm down.
Mm-hmm.
If somebody has a lot of fear,
Yeah.
about the injections or whatever, you just do this one,
Yeah. First.
and people just can relax, and then it can becomes easier to work.
Yeah, that one helped me with even the lymphedema in my arms, like the swelling in my
Right.
arms. The stellate helped with a lot.
Yeah, yeah, yeah. And it says it is easy and safe to do injection when you know how to do it.
Yeah.
So, and it's done with, and that one I do almost on every patient when I do my psychological work. So basically, you need 5 cc syringe. You need a very short half-inch needle, 0.2. So it's a very, I can show you, this is the end of it.
Yeah. It's very
So it's a
small.
very short needle,
Mhm.
but you can, if the neck is turned, you can palpate where it is, palpate by the neck,
Is it
and
like
with the needle,
C6 or which
yeah, it's on C6,
C6?
and there is a little tubercle there, kind of,
Yeah.
elevation, which you can palpate,
Yeah.
and then you get needle there, you hold it very kind of so it would not move. And before you inject, you need to see are you in safe place or not. You retract
See if it's
syringe a couple of times, rotate it, and then you start injecting, rotate it again, check it again, rotate it again, and I usually inject about 4 to 5 cc of 1% of procaine, which is safe, and it helps people to relax.
It is a very powerful tool, I have to say. It was one of the only things that catapulted me into my being able to heal, it felt like. And I was doing all the vagus nerve stim I could, and I was humming, but when I was this kind of like the toxicity was just my body needed a little reset. It needed to feel safe for that like few minutes where it could start to
Right.
turn on the anti-inflammatory response. So yeah,
Yeah.
and you're in New York, and or do you take new patients now, or do you train other people? You said you taught a little bit too, right?
Yeah, it's not me. I'm kind of, with my stuttering issues, so I like to learn.
Yeah.
So I was inviting teachers from Germany and Switzerland, Spain, advanced neural therapists,
Mhm.
and I was organizing groups, hosting them. So that was my role.
Yeah.
And I'm almost ready to teach, kind of.
And you
There are
have,
very few.
but you
Uh-huh.
have is there like there's like a directory where people could find other neural therapists? I forget what it's called, and they can find you if
So
they're in
we
the area.
have an association. It's short stands NAANT.org, or North American Academy of Neural Therapy.
Mhm.
And we have a website, and there is a list of neurotherapists in the United States,
Mhm.
and Canada, and some of them in Mexico,
Mhm.
so who basically are doing it.
Mhm. But
Uh,
do you take new people just to be
I
clear?
do, I do, I do,
Okay,
I do.
perfect.
I'm
So
interested in challenging patients, so
yeah,
so I'm open, but I don't take any insurance for years, so
yeah, out
so
of
but
pocket.
that's
People.
yeah.
Okay.
Yeah. Unfortunately,
No, it is what it is. It's what it has to be. People pay for good care. So, is there anything else you want to tell people about what you do before we go? Because I mean, I could talk to you for hours, but I'm going to be respectful of the hour, and then
right, right. It's basically, I think, I So, so as this issue in last journal of American Psychiatric Association says, so post-traumatic syndrome or PTSD is a very important and quite often missed. But PTSD creates a lot of emotional and physical consequences. And what's interesting that about 70% of population experience one or another form of PTSD, and about 4% of men and about 7%, 6-7% of women continue to have it in their life. And that can manifest in all kind of different ways.
Mhm.
And if you don't resolve it, then basically you're going to be carrying a lot of negative issues in your life. And quite often, as you mentioned, in your case, it has been misdiagnosed, and so basically it was missed, and that's what often happens.
Mhm.
So we need to be vigilant, and people need to talk to their psychiatrist and think about what may have happened and how it may have contributed to what their issues are right now.
Mhm. Because it changes your immune system and your inflammatory markers, and that over time turns into disease, right? We have to find,
Yeah.
right?
It affects it all. It affects us on multiple levels, And the worst thing, as we talk about, it has epigenetic component,
Mhm.
meaning if we don't resolve it in our lifetime, our children or grandchildren may carry it.
Mhm. Yeah, so you stop it with you, right? We got to get more biologically interested to like really get vibrant health, and that's what we pass on. You can change the whole lineage, right? From healing yourself.
Right, right. We have responsibility. I am as a grandfather, I'm responsible for my grandkids and my daughters, so I want them to be well and I want them to be healthy. So I need to be an example because
Mhm.
nowadays, unfortunately, people are not taking care of themselves, and we see all kind of epidemics.
Mhm.
And,
They're all
so
stuck in their
it's not
stress response. Well, thank you so much for your time and all of your insights and everything that you're doing. I know that people will love this episode. So, can you tell us where people can find you? Your clinic's called Transformational Healing.
transformational healing solutions, or they can find me by my last name,
Mhm.
Michael I. Gurevich, Gurevich, MD, and my phone number 516-674-9489. So feel free to call me or whatever if on your site you can put it.
Yeah.
And I will send you a couple of things. So you want about honeybee venom?
Yep.
Uh,
And
what else?
I'm gonna say some books. A book that you were reading on. Oh,
Oh, yes, autochemolytic therapy, right?
yes.
Okay,
Yes. Okay, we'll
okay,
put that in the show notes. We'll put your website in there. And yeah, thank you again so much for being here. Like I very much appreciate your time. You
okay.
okay,
Thank you. Okay, take care.
thank you.